Hi, George, registered respiratory therapist here again to talk to you today about preparation, specifically preparation in meeting and doing something to your patient. There's a few things that we want to consider before we, in fact, do a procedure on our patient. And I know it sounds kind of funny, but a lot of this stuff is, in fact, common sense and things that you should employ before you start doing something to a patient. Now, it's kind of broken down into four distinct areas. The first one is making sure you check the chart and you've got doctor's orders if you're a respiratory therapist or a nurse or something to ensure that you've got coverage to do that procedure. The second thing you want to do is make sure that you put your personal protective equipment on, the things that you'll need to protect yourself from the patient as well as protect the patient from you. The third thing is introducing yourself to the patient. And the last thing is physical safety of the patient's environment. So the first thing we talked about was checking the chart and verifying the orders. The chart is really important. And when you grab the chart and you start looking over the chart of your patient, you want to be looking for things like, of course, the doctor's order that basically tells you you've got coverage if you're doing that procedure to the patient. The second thing is making sure you've got the patient's name and birth date, as well as pertinent lab findings that might be there from, say, the lab or x-ray, etc., nursing notes, plus any other respiratory therapy notes that might be in there. And the other thing you want to get is any kind of assessments that were done on your patient as well. Any information that really would help you to get a bearing on your patient before you see them. Obviously, in the event of an emergency, you can write down everything and check the chart after, but if you need to perform some sort of emergency life-saving operation, you may not have time to check the chart before you need to assess and do something to your patient. And lastly, you might be looking for patient consent for some of the procedures that you might require to be done to that patient. So checking the charts, very, very important. A lot of stuff in here that you can get about, or knowledge that you can get about your patient from other healthcare professionals, as well as ensuring that you've got doctor's orders to do that procedure. Unless you're a doctor, then you can write your own order of what you're going to do, I guess. Anyways, that's the first thing. Checking the chart, making sure you've got the important information from the chart. The next thing you need to do is get yourself ready to see the patient, and that means employing infection control procedures, or what we call donning the appropriate PPE. Now, at this stage, you could also go and grab your equipment, have it laid out and ready to go, but you want to still make sure that you're properly prepared to go into that patient's environment. So some of the things that you need to focus, and the number one thing is make sure you wash your hands before you go into that environment, or at the very least, put some isopropyl or some sort of antibacterial salve on your hands that'll help kill any kind of bugs or germs that are there. But washing your hands is always the best method. So ensure you wash your hands with lots of soap, lather up, really, really good on the hands, maybe sing Twinkle, Twinkle, Little Star, something like that, so that you take the correct amount of time to ensure you're killing as many bugs that might be on your hands as possible, that you might be carrying from the last room that you were in, or maybe from your bologna sandwich that you have left over. So wash your hands, dry them off. Once you've done that, you can start putting your personal protective equipment on that you want to wear. And that all depends on the level of isolation or how many different types of bugs the patient might have on them or might be inside their environment. So some of the more common and simple things that we like to wear, well, first of all, safety glasses. Safety glasses to protect your eyes if you're not wearing glasses, or safety goggles to protect your eyes if you happen to be wearing glasses. Right, so these will go over my glasses if I need to wear them. Gloves. Oh, I guess you don't need 3 gloves. 2 gloves will be fine. These are clean gloves. You would use these gloves if you had to do a procedure that didn't require sterile technique, or you would use sterile gloves if you're doing a procedure that required sterile technique. For some other things that you'll need, a mask. Make sure that if it has this metal insert in it, that it's where your nose goes, so you can contour the mask to your face and to your nose. Provides better protection for you and for the patient. Also, if you're working in an area you needed protection from fluids, you could use one of these fluid shields. So it's got the mask portion right over here to help protect you, as well as protection for your eyes too. So you could wear one of these as well. You would also possibly need to wear a bouffant like this. This covers your hair. Now you could style it to make it look more Parisian in nature. I guess I'm not really getting that effect. But there's the bouffant to protect your head and prevent hair from falling onto the patient's head, and also from you getting anything on your head as well that could be a bit of an issue. Gown. If you need to wear a gown for the procedure that you're doing, make sure you've got the appropriate type of gown. Sterile gowns for sterile procedures, clean gowns for clean procedures. And you might need some of these things. Blue pads or absorbent pads. Pads that help to absorb any kind of liquids or secretions that might come out of the patient, or you might drip or what have you. You might need to use these blue pads for whatever reason. They're self-absorbent pads. So once you've got all that lined up, you've got all your PPE on. I'll put the gloves on as well. We're going to have clean gloves on. Take the equipment that you need, go to the patient's room, and if there's no door on the room, there's just a curtain there, try to get their attention by tapping on the wall if there's a wall, or trying to make a noise to get their attention. But make sure that you get their attention, open the door or pull open the curtain, and then walk in and say something like, "Hi, my name's George, I'm a respiratory therapist." But if you're not me and you're not a respiratory therapist, just simply say your name and what professional designation you are. If you're a student, make sure you say, "Hi, I am so-and-so, and I am a nursing student," or "I am a respiratory therapy student," or something like that. Okay, so you're in the patient's room, you've introduced yourself to the patient. The next thing you need to do is make sure you go up to the patient. Now, as you're going up to the patient, it's probably a good idea that you inspect the environment that you're walking into. And you can kind of do this concurrent as you're introducing yourself to the patient as well. So you're going to be checking things like, how's the lighting? Is the lighting good? Can I see well enough? How's the sound? If I need to use my stethoscope, can I hear the patient's breath sounds or cardiac sounds when I use the stethoscope on the patient? Or is there some music that's playing that might be just a little bit too loud? Or some people talking in the room that might impair your ability to hear what you're listening for? So lighting, sound. The other thing you want to do is check the floor. Make sure you're not going to be tripping over anything. Or check to see that there's no sterile fields that you could possibly walk into. Or check for things like, I don't know, body fluids, blood on the floor, secretions from the patient on the floor, a tipped over kidney basin that might have had some water in it, or vase or glasses that they have for drinking their own water. That's the case. But just make sure it's not slippery, that there's nothing in the way, nothing on the bed either, right? Somebody else might have been there. Maybe you left something on the bed, a pair of scissors, and the last thing you want to do is put your hands on the bed and feel the effect of those scissors, or sit down on the bed and feel the effect of those scissors on your rump, right? So make sure it's safe for you, safe for the patient, properly check and inspect that environment. Walk up to the patient as you're doing that, and when you get to the patient, just simply say hi again if you haven't already said that. Hi, my name's George, or whatever your name is, and ask to see their ID tag. It could be on their wrist, it could be on their arm. But see their ID tag, ask them their name, ensure that their name matches up to the name you're needing to do, or the name that you have, so that you're doing the procedure on the correct person. But also check their birth date, or ask them what their birth date is. If the birth date matches up to the one that's on file that you have, then you know you've got the right person. Because the last thing you want to do is do the procedure on somebody named Smith and then find out that the Smith you're dealing with is the wrong one, because Smith is a fairly common name in some parts, or whatever the common name is in the part that you live around the globe. So make sure you've got the correct patient, you're doing the procedure on the correct patient. Once you've done that, now you can start explaining to the patient what it is in fact that you're planning to do, whether it's a simple assessment or a more invasive technique. At that point in time, simply use simple words to describe what you're going to do. Hi, I'm going to take a listen to your chest because I want to see if you're having any issues with your breathing. Something very, very simple. You don't have to throw any big words or fancy jargon in there at that time. Just something to alleviate the stress that they may feel, and something that will also put them at ease with what you're going to do. It just makes it better for the patient and the situation that's occurring at that point in time, because not everything you're going to do to the patient is going to feel good. So once you've done all that stuff, now you can go ahead and do what it is that you wanted to do, or were required to do for the patient, the assessment, the treatment, the invasive technique, or what have you, right? So just to kind of recap what we've done, we talked about making sure we check the chart, that you've got the doctor's orders, getting any pertinent information, consent if it's required, as well as any laboratory findings or previous assessments done by any other medical staff, and also possibly grabbing that birth date. Next thing you do is you're going to get the appropriate personal protective equipment on, whether it's the bouffant or the mask, type of gloves that you need, etc. So you've got the protective equipment on, you've got your equipment, now you can go and introduce yourself to the patient. If you're opening the door, of course, or the curtain, make sure you close it behind you as well, right? You want to make sure you've got that privacy that you require for that patient environment. So checking the hazards as you're walking in, making sure it's a safe environment for you physically, but also making sure that you've got the environment set so you can do your assessment properly or perform your procedure properly for your patient as well. And of course, during the introduction, you're introducing yourself and your professional designation. You're also confirming the patient's identification by asking them their name and then confirming it's the correct name that you have to do the procedure on. You might want to check their birth date as well to ensure that you've got the correct patient. Hospital ID numbers, if that's required, could be their Alberta Healthcare or whatever their healthcare number is. And also make sure that you explain the procedure to the patient as well in terms they can understand. And make sure you're professional in doing so. So that pretty well wraps it up, how to prepare yourself for any kind of patient interaction where you're going to have to perform a procedure on the patient. I hope it's been beneficial. I hope you got something out of it and realize there's just a little bit more to it than just walking into a patient's room. So with that, if you have any questions or comments about this video, how it could be made better, please let me know. Usually I'm a one-man show, me, camcorder, and a remote control to do these videos. So I'm looking forward to any input that you have. Until next time, this is George, registered respiratory therapist and rancher, bringing you the latest and greatest in respiratory therapy as well as other types of medical stuff from around the world. Well, actually, it's not around the world. It's here in Alberta, Canada. Have a great day. Now, where's that remote?